Hello, Mr. Gordon. It's nice to meet you. So let's talk about what's going on today. Nice to meet you too, Dr. Shelby. So I've been having pain and swelling in my right leg that started about 4 days ago, and nothing seems to provide relief. The urgent care recommended I see you. Okay, I'll take a look at your leg in a moment. Just let me confirm a few things in your medical history, okay? So I see from your pre-appointment form, you have high blood pressure, type 2 diabetes, high cholesterol, and some kidney issues, correct? Yes, unfortunately, that's all true. Well, no worries. You're not the first, and together we could start chipping away at these issues. Now, I see you also have atrial fibrillation. Yes. How can I forget that one? And lastly, I see you had what we call an unprovoked deep vein thrombosis 3 years ago. I did indeed. I spent a few days in the hospital for that, but all good now. If you don't mind my asking, do you have a chance to exercise at all during the week? I try to putter around the yard a bit, gardening, raking up leaves, that kind of thing. Does that count? Absolutely. That's good to hear. How about alcohol? Do you drink? I do enjoy a cocktail or two in the evening, usually bourbon. Sometimes wine with dinner too. Okay, and how about your job? Are you sitting most of the time, or do you move around fairly often? Well, I'm a telemarketer at a call center, so I'm definitely sitting for extended periods of time. Okay, tell me a little more about the swelling and pain in your leg. Sure, this is actually the second time it has happened to me in the last 3 years. The first time I went to the hospital for the deep vein thrombosis. I was given injections and I took a blood thinner, but I had to watch my diet and get tested regularly, which was difficult with my job. I remember getting nosebleeds and even small cuts that would take forever to stop bleeding. So I stopped taking it after a few weeks. I'm hoping this isn't going to be another DVT with a hospital visit for injections again. To be honest, I'm not crazy about shots because I'm already taking insulin every day. Now, how about for the atrial fibrillation? Are you taking a blood thinner for that? Yes, warfarin. So I'm back to the testing, which really is inconvenient. Well, I don't want to get ahead of ourselves, but there are newer anticoagulants called direct oral anticoagulants, or DOACs. These are pills that could be a possibility for you. They don't require the prothrombin testing, but we will have to explore your conditions a little further. What I'd like to do is do a physical exam and take a closer look at your leg. Does that sound okay? Absolutely. That's what I'm here for.